Stroke is a serious, life-threatening medical condition that happens when the blood supply to part of the brain is interrupted or reduced. The blood supply to the brain is compromised. Brain cells begin to die in minutes. This disruption can be attributed to two primary causes: an ischemic stroke or a hemorrhagic stroke. An ischemic stroke, which occurs by a blockage or narrowing of arteries supplying blood to the brain, resulting in severely reduced blood flow, accounts for about 85% of all the cases of stroke. Obstruction is due to blood clots or fatty deposits lining the vessel walls, atherosclerosis, while hemorrhagic stroke occurs when a weakened blood vessel in the brain bursts, causing bleeding into the area in or around the brain. Account for around 10% of all the cases, accumulating blood in the surrounding tissues and exerting pressure on the delicate brain structures, and may cause various neurological symptoms depending on the affected area of the brain. Strokes impact millions of people around the world, significantly affecting their physical and cognitive abilities. While strokes can lead to life-changing outcomes, many people are unaware that they often present warning signs weeks or even months before they happen. Early indicators offer a critical chance for early detection and intervention. In this video, you will learn early warning signs of a stroke that may appear up to a month before the event. Number 1. Sudden, severe headache. A sudden and severe headache, often described as the worst headache of one's life, can be a sign of a stroke. This type of headache can occur without warning and may be accompanied by other symptoms such as nausea, vomiting, or altered consciousness. This is more common with hemorrhagic strokes, where a blood vessel ruptures and causes bleeding in the brain. Number 2. Numbness or weakness. Numbness or weakness that affects the face, arm, or leg, particularly on one side of the body, making it difficult to smile or raise both arms evenly. This occurs because strokes often affect one hemisphere of the brain, can lead to weakness or paralysis on the other side of the body, and vice versa. If you notice this symptom, it's crucial to seek medical attention immediately. Number 3. Transient ischemic attack, or TI, often called a mini-stroke. TI is a temporary period of symptoms similar to those of a stroke. It can last a few minutes or persist up to 24 hours. TI doesn't cause permanent damage. That is a significant warning that a major stroke could happen soon. Number 4 is speaking difficulties and slurred speech. Strokes can impair the ability to speak or understand language, a condition known as aphasia. This can manifest as slurred speech, trouble finding words, or complete inability to speak. These symptoms typically occur when a stroke affects the areas of the brain responsible for language, such as Broca's or Wernicke's areas. Number 5. Sudden trouble seeing in one or both eyes. A stroke can cause sudden vision problems, including blurred vision, double vision, diplopia, or complete loss of vision in one or both eyes. These symptoms arise when the stroke affecting the brain's visual processing centers. Number 6 is dizziness and loss of balance. A stroke can cause sudden dizziness, unsteadiness, or difficulty walking, often leading to falls or a feeling of spinning, that occur in the cerebellum or brainstem, which are areas that control balance and coordination, often cause these symptoms. Number 7 is unexplained fatigue. Fatigue during a stroke can occur suddenly and without a clear cause. This overwhelming tiredness or exhaustion is not relieved by rest and can make it difficult to perform even simple tasks. It occurs because the brain is deprived of oxygen and nutrients due to a blockage or bleeding. Number 8. Difficulty swallowing. Dysphagia refers to difficulty swallowing and can be a common symptom of a stroke, especially if it affects the part of the brain that controls the muscles involved in swallowing. This can lead to coughing or choking when eating or drinking, a sensation of food being stuck in the throat. Number 9 is sudden memory loss or confusion. Strokes can cause sudden memory problems and confusion, such as difficulty remembering recent events or finding it difficult to think clearly. This symptom occurs because strokes can damage parts of the brain involved in cognitive functions and memory. A person may appear disoriented, have trouble concentrating, or seem unable to understand what is happening around them. Number 10. Sudden changes in behavior or mood. Strokes can lead to sudden and noticeable changes in a person's behavior or mood. This might include becoming unusually irritable, anxious, or depressed, or experiencing sudden mood swings. Emotional responses may become exaggerated or inappropriate to the situation, reflecting the brain's altered function. These symptoms can be subtle but are important indicators of a potential stroke. Immediate medical attention is crucial to reduce the risk of long-term damage. That's all for today. Thanks for watching.